So my stance is that the literature shows this caution. We're never going to have, I think a lot of the arguments is, I want causal evidence for this. I
Right.
cannot do an RCT where I randomize an adolescent to smoke cannabis and develop schizophrenia, or smoke placebo
Yeah, sure.
and not develop schizophrenia for ethical reasons, for follow-up reasons, it will never happen. So the strongest evidence that we have are these association studies. And I think we need to make sure that the public is aware of these so that people can make informed choices and not think that cannabis is just very benign. It can
Right.
be, but it needs to be something that is well informed and supervised for that setting.
Yeah, I think, as I was of the opinion long ago that cannabis was benign, as a adolescent, and as you go through life and you start seeing the effects of people's decision making, friends, acquaintances, and that sort of thing. And I'm definitely, just anecdotally, in my mind at least, it should be used with caution, especially with these high potencies. Because have you worked with any cases yourself of these schizophrenic breaks because of cannabis use?
Oh, I've seen a number, yes.
Yeah.
Both on call and both when I'm working on the inpatient ward of people that are now admitted to hospital with these psychotic symptoms. And then it's always hard, again, to tease out the causality element, but a lot of people with schizophrenia, their index episode is surrounding cannabis use. And even if they're not using it anymore, again, not to put all the blame on cannabis, but if an association and a strong association of that exists, it's pretty alarming.